In this video demonstration, you will learn how to add and administer new immunizations in CIIS. Adding new immunizations into the registry is a two-step process. First, you must add vaccines into the system by providing basic information. Second, you must administer the vaccines by providing additional information, such as vaccine inventory. In order to officially record an immunization as having been administered in CIIS, you must complete both steps of this process. If for some reason you choose to add vaccines without administering them, please remember the vaccines will be saved to the patient's record. However, they will not be officially recorded as having been given. To add vaccines into the registry, click the Add Vaccines button located on the immunization home screen. You will be navigated to the Add Immunization screen. Notice you have links to additional information at the top of the screen, including vaccine package inserts, latex and vaccine packaging information, and vaccine excipient information. You will also be able to see any precautions or contraindications specified for the patient. For this patient, there are no precautions or contraindications. A checkbox with the message, "Do not set this clinic as the default clinic for this patient," will be displayed on this screen as well. In CIIS, when a patient receives a new immunization, they are automatically assigned to that clinic. If for some reason you do not want to take ownership of this patient by administering immunizations, then you can click this checkbox and the system will not automatically assign them to your clinic. The reminder date field will not be used by most providers or clinics. Notice the patient's VFC eligibility status will also be displayed on this screen. To add vaccines on this screen, confirm your clinic. Enter the vaccination date. Notice the age of the patient will also auto-populate based on the vaccination date entered. Next, select the person who prescribed or ordered the immunizations. The next step is to enter the vaccines that you are adding to the system by using the vaccine drop-down arrow. You can add vaccines to the screen. However, you will notice that today's recommended vaccines will auto-populate on the Add Immunization screen. If you choose to clear out the recommended vaccines, click the Clear Vaccines button and simply use the drop-down arrow to add a vaccine. If you press on the Display All Vaccines button, the system will display all active vaccines instead of only current age-appropriate vaccines. For each added vaccine, you will need to select a vaccine information statement by clicking on the Select VIS button. Next, click on the VIS that you have given to the patient. If the VIS you have given is not listed, click the checkbox next to the statement that says the VIS given is not in the list above. If you select this checkbox, you will need to manually update the vaccine record with the correct information. Once you have made your selection, click on Save Changes. Please note, if you do not either select a VIS or click on the checkbox, the system will send you a warning message when you try to administer the vaccine, telling you there are vaccines without a VIS associated. You will then need to go back and correct those vaccines before proceeding. If a patient has refused one vaccine or all vaccines for today, you have the option of entering that information on this screen. You can enter the exemption or deferral for all vaccines listed, or you can enter it individually corresponding to the appropriate vaccine. Please note, medical exemptions must be entered individually. If a medical exemption is selected, the system will ask you to enter the precaution or contraindication. For our purposes, this patient has refused the PCV13 vaccine. The vaccine refusal reason is deferred. Once I save this information, the system will automatically generate a vaccine refusal note. When you go back into patient notes, you will see this vaccine refusal note. Once you have entered all necessary information on the screen, you will either create and administer to continue to the Administer immunization screen and record all immunizations as having been given, or you have the option to click Create. If you click Create, you will save the information on this screen. However, you will not have officially recorded the immunizations as having been administered or given in CIIS. It is strongly recommended that you create and administer at the same time. Click the Create and Administer button. You will be navigated to the Administer immunization screen where you can continue to enter additional information for your immunizations. On this screen, you will again see additional links to information, including body site abbreviations. This corresponds to the body site codes you see on your screen. You will again see the patient's VFC eligibility status. At this point, enter the person who administered the immunizations. You will also have another opportunity to enter a refusal reason. Next, enter the vaccine inventory from the drop-down arrow. Be sure to select the appropriate inventory, including the lot number, expiration date, and funding source. Select the body site, and notice route and dosage are auto-populated, though you may change the route if you choose. When I try to select the vaccine inventory for the RotaTeq, I notice there is no inventory to select from the drop-down. The reason is because I did not enter my inventory for this vaccine into CIIS. Therefore, the system will not let me administer this immunization until I have entered the appropriate vaccine inventory. Also, notice the system automatically checked "Did not administer for this vaccine." At this point, the RotaTeq will be added to the system, but until I go back and enter the corresponding inventory, I will not be able to administer this vaccine. I can administer the polio IPV because I do have corresponding inventory information entered. One final note: if you have added vaccine and determined you need to delete it out of the system, you can click on the checkbox next to Delete, and this will delete your added vaccine. Once you've entered all of the information on the screen, click the Update button to save the record. Notice the system sends me a warning message telling me that one or more immunizations has been added but not administered. These immunizations could be influencing the CIIS recommender. These immunizations will be automatically deleted 35 days after the immunization date if they have not been administered. I will click OK to proceed. You will now be navigated back to the immunization home screen. As we look at the patient's record, you will now see the polio vaccine that I administered on the patient's record. This vaccine has been recorded as given. However, you will notice the RotaTeq vaccine is still in the system as added but not administered, as indicated by the syringe icon. I must either delete this vaccine out of the system or enter my inventory and then administer the immunization. Once I enter my inventory, I can click on the Administer Vaccines button and enter the appropriate information to save this as an administered immunization. Until you either delete the vaccine or administer it in CIIS, the immunization will remain on the patient's record with the syringe icon, indicating that the vaccine has been added but not administered. You will also notice back on the immunizations home screen, PCV13 vaccine. This is the immunization my patient refused today. However, a vaccine refusal does not affect the recommender. It is still going to continue to recommend this vaccine. If you click this link, you will be taken to the patient notes screen where you can view vaccine refusals that have been documented in CIIS. Thank you for watching this demonstration and enjoy the rest of the course.